Action.
I just found out that one of my close family members has type 2 diabetes. I don't know anything about it. I wish there was someone that could help me.
Hey! I think I can help.
Yeah?
You said your family member has type 2 diabetes?
Yeah, they do.
How long have they had it for? Do you know?
They just got diagnosed. I don't know.
Do you know any of the signs and symptoms that led to them being diagnosed?
I really don't.
So, one of the frequent signs and symptoms could be frequent urination, because type 2 diabetes comes from having too much glucose in your blood, and that can, because of a lack of insulin or insulin-resistant cells. Insulin is sort of like a key that'll open your cell and let the glucose in, which will fuel it. But if the insulin can't open it, then you have too much glucose in your bloodstream, and your body tries to expel that through urination. Do you think that your family member has ever had any of that?
I think so, yeah.
And obviously, if you urinate a ton, then that can lead to them being always thirsty. Can also be always hungry or always tired, or even have blurry vision or numb, tingling hands and feet, because the cells just aren't getting the fuel they need. So it can be nerve damage in your extremities since they're so far away from the heart, or it could be blurry vision because your optic nerve and your neurons aren't getting the fuel they need to make your eyes work properly. And always hungry or tired is pretty self-explanatory. If you don't have the fuel to go, you can't really go.
Yeah.
Unfortunately, this could also lead to wounds that won't heal, because the blood glucose is all in the blood vessels, and that can block the pathway for the oxygen and the nutrients to sort of get to the wound and have the platelets work and get the nutrients to wrap it and heal it and all things like that. Do you think your family member has shown any signs of any of that?
Maybe. I'm not really sure.
That makes sense. There is one more sign or symptom, and that's some genital area sort of weirdness, because you can have sexual problems, or if you're a woman, have like vaginal dryness or infection because the blood flow to the areas are affected. So what do you think? Has your family member been treated at all?
I know that he's going to the doctor, but I don't really know what they're doing for him.
Okay, well, there are some options. You could be having oral meds, or just making sure that they're monitoring the blood glucose. They could encourage more physical activity, or even just counting your carbs, making sure you're having regular meals and regular snacks. Maybe some even specific foods to really help get that going. However, if the treatment doesn't seem to be working, or if he's not even really getting treated much at all, and they're just trying a ton of different things, it could lead to eye problems, as we discussed before, neuropathy, which is the official term for that nerve damage that we were talking about, hypertension, where the blood and glucose is so full that it sort of stops the heart like a hose when you pinch it, and it builds up all here, and then you let it go and it kind of shoots out. That's kind of what might be happening in the blood vessels with the blood flow. Or it could even lead to just heart disease or kidney disease.
No, I'm still a little confused on what causes all of this.
Well, so like I said before, insulin causes, like a lack of insulin can cause it, or if your cells are insulin resistant. It can also be more at risk if you're obese, if you're old, if you have a sedentary lifestyle, or just if you're genetically predisposed. But if you're confused about the insulin part, come with me. I think I have a little visual for you. So insulin is like a key. This is the key to my room. And so if we pretend that this is the resistor, the key, usually takes one, maybe two swipes, and then you get in just perfectly fine. But if you have a resistor on it, just wait and see. We're almost there. You can put it to the lock, and all you want, you can swipe and swipe and swipe, and nothing is really occurring there. Eventually, it might be not resistant anymore. It's not working now, but if it's super resistant, then your body will produce more and more insulin, try and try and try again, and eventually it might just give up. This can lead to like a lack of insulin, or just even no insulin whatsoever, affecting all that blood glucose.
Hey, I think I understand it now.
Awesome.
Thanks so much.
No problem.